have such a huge problem now. We have to move from what I call this episodic care into this long-term, lifelong care, and actually you cannot do that alone.
Those residents that used to be in hospital are now in nursing homes, and those residents that used to be in nursing homes are now in residential homes, but the skill set hasn't changed.
We've got a health and care system that's set up to look after people with single system diseases, and we're trying to squash people with very complex needs into single system disease boxes, and it just won't work.
I always want to create legacies and leave something better than what we actually came into.
I think people can really see the difference he's making, and I think especially for clinicians and managers, it's really tangible, it's real.
I've been in nursing for over 30 years, and I think this is the biggest innovation, but the most simple innovation actually.
It doesn't feel like something where you're writing a plan or sitting in a meeting. It actually feels like real change happening on the ground.
I really feel we're making a difference.
At last, more people than us, the specialists, are interested, and everybody's getting to know this is everybody's business.
We know people are living older, and we also know that there are challenges in terms of the ageing population needing care for longer. But we also see that there's some challenges for the providers being able to live within the funding that they receive, and also in terms of families no longer live with people so long as they used to. So we need to think about different ways of society supporting people to live healthy, long lives. There are 6 Vanguards. They've been working together to identify what are the things we're going to do to help improve the health of people in care homes. We've identified 7 things you need to do in your local area to improve that health. One of those key elements is enhancing primary care, and you do that by joining up all the people who deliver care.
Here in Sutton, our Vanguard is focusing on joined up care. What we're trying to achieve is that the resident is at the centre of everything that we do, and we all work together as a team to improve the life of that resident in our nursing home. It may not be that we all sit together in a meeting discussing that resident, but it's about communication and sharing information.
Yes. So I just wondered about this gentleman, what pain relief he's on.
This gentleman is on paracetamol.
The care coordinators are a really important role. Their role is really sort of pulling everything together.
And how he's doing at the moment?
He's doing well.
It's about spending more time with the residents. It's about spending more time with the residents' families. And it's having that extra sort of time off of the floor to dedicate to that role.
But still in pain?
Still in pain.
Okay.
We also have linked GPs dedicated to the residents at this home, and comes in on a weekly basis. The care coordinators prepare for his round. We discuss with him, the families have got access to him. It's a longer round, it's much more time, and it's much more valued time now. He's reviewing many more residents as well. For me, one of the great successes out of this Vanguard is the red bag. It's as simple as a red bag, but what's really important is the pathway and the paperwork that goes along with the red bag. It was born at Crossways out of a meeting that we held with the hospital. What was going wrong? I think people were going to hospital from care homes. Their information wasn't being transferred. We put people's belongings, we put a change of clothes in, primarily for when they're discharged, because before, I'm sure everybody's seen it, patients being discharged in gowns, and we put their personal belongings in it, but most importantly we put the paperwork, so what the resident is normally like. We also put in social history and things like these. Things are really important.
Everything is packed up there.
So that's handed over to the ambulance service. So they then take it to the hospital, that's handed over to the hospital. If somebody's admitted, that's handed over to the ward. So it's literally about this red bag following with the patient the whole way through the journey.
When I have a sepsis attacks, I really don't know anything about it. All I know is that the red bag has travelled with me in the ambulance. The red bag gives my family the security of knowing that all the information that is in the red bag will have helped me. Right from the beginning of the Vanguard meeting, I attended and have always been involved from then on. If there's only the voice of the manager, they don't hear the voice of the people.
I'm really proud of the relationships that we now have with the multidisciplinary team. But most of all, I'm proud that the residents' life is improving in the nursing home.
So it's really important to get people working together and to build strong relationships between staff delivering care. But on top of that, we also know we need to break down barriers to help organisations work together if we really want to make this work.
What we've done in Newcastle and Gateshead is bring together all of the organisations and, importantly, all of the disciplines. That's the people who our patients and their families would meet on their care home journey. And the reason that we've done that is because that's the best way, the very best way to make sure they get the best care. Okay, so moving on to the main part of the session, we're going to review our end-of-life work plan. So we've got 9 organisations representing 8 disciplines that come together as a pathway of care team. What's great about it is having all of that expertise, all of that knowledge, all of that understanding in a room in one go.
We're going to try and offer 2 monthly palliative care meetings with the older persons nurse in the homes.
We know that if you're going into a care home, you're likely to be in the last years of your life. Therefore, it's really important to bring together all the different people to support you to get your end-of-life care wishes met. The Vanguards have worked really hard to do this and see it as a central part of their local care model.
Every week we have a pathway of care meeting and we focus on a different element of work.
Until I started to come into the meetings, I didn't even know you were out there in Gateshead.
It's conversational leadership. That's what it is. It's everybody coming together, learning from one another and going out and being a frontline leader, because we need leadership at every level. We could take that patient story that you've shared, if we could use that as a base to maybe think about what the pathway needs to be. The workforce is much better equipped because of the learning, so their knowledge, their skills are greater, and it's joined up.
I couldn't really understand why, but they just seemed a bit reluctant to have her back.
The relationships are better because we don't just need relationships with our patients and their families on an individual basis. We need the whole system to have relationships, and that's what we get through all of us coming together. There are definitely less people going into hospital, there are less people in A&E departments, and there's more care being provided in the community that would have traditionally once have only been provided in secondary care. Anybody can do what we've done, anybody. All you need is for organisations to know their best people, their best people to field.
One of the key things we can do is to keep people in the community for longer, to support them to stay at home through reablement and rehabilitation. But once they go into those care homes, allowing them to have opportunities for the community to come in and work with them. So bringing the community to wrap around and be part of the care home.
1 in 25 people move unnecessarily into a care home where they could have been supported in a more independent setting. That's absolutely what Wakefield's Care Home Vanguard is about, maximising people's independence for as long as possible. The asset-based approach, working with our community, working with our volunteers, really helps that sort of mental wellness, which obviously impacts, if it's not right, negatively on the physical health. We have organisations called community anchors. So community anchors are sort of physically buildings that are located right in the heart of the community, and they put stuff on for people in the community.
Being part of the Vanguard actually means we go into a local independent living scheme. We have a team of volunteers who deliver lots of different activities.
She gets a lot of reward just by mixing and coming out of a house.
So it just helps to combat some of the social isolation that some of these people sometimes feel.
There's a lunch club on a Tuesday that Jean could come to.
I'm Marjorie and I've been living here nearly 2 years and I'm 90 years of age. Somebody told me when my husband died that if anybody asks you to go out anywhere, go, because they won't ask you again. So I do that. We do get encouragement, yes. Lots of people come from NHS and we get clothes parties and jewellery parties, all sorts of things.
The volunteers are actually becoming a part of these people's lives, and it's a very important part of a holistic wellbeing approach.
We're seeing the multidisciplinary clinical team is really understanding and valuing what our community groups can offer.
Technology is really important to you and I, but it's also really important if we want to deliver better care in care homes. It allows us to take care into the care homes from elsewhere in the NHS, but it also allows us to join up information to allow us to make better decisions about the care we provide.
Since 2011 we have run this 24/7 clinical hub, which means that care homes can access us and nursing homes can access us 24 hours a day, 7 days a week, 365 days a year, and they get a clinical response to any kind of worry that they have, any question that they have.
Hello.
I'm Louise, how can I help today?
This is Eric Pickles.
Hi Eric.
Hello there.
Hello.
Hello.
Eric's been quite withdrawn over the last 24 hours.
The staff that are answering the calls are a mixture really of different specialities, all registered practitioners.
His diet and fluid intake's been declined slightly.
Eric, can you tell me a little bit more about how you're feeling today?
I was a bit lethargic.
The care home staff, in terms of benefits, can get a call answered immediately, and if they've got a worry and they're not sure whether they need to get the GP or a district nurse or they can deal with it themselves, then we can give them the answer to that, and we can actually help support them to deal with that issue too.
What I want to do is I want the staff to start monitoring your input, how much you're drinking and how much you're eating throughout the day, okay?
In terms of the benefits for the residents, mainly it's the fact that they don't need to travel anywhere, so we actually take the care to them.
Sample of his urine and perform a urine dip.
For the carers, they have the confidence of immediate access to competent medical advice. They don't have to wait hours for a GP or an out-of-hours doctor. For us, there's a huge reduction in workload because we're avoiding visits, and it's benefiting our other patients too because we don't need to rush out in the middle of surgery to see a poorly patient in a care home.
Do we need to inform the GP?
At this point, no. I think if we just continue to observe, and obviously if there is any change at any point, then by all means get straight back in touch.
I've been in nursing for over 30 years, and I think this is the biggest innovation, but the most simple innovation actually. And what it's all about is all of us doing what we do really, really well, but doing it in a much better, much more efficient way using the technology that's out there.
The people who deliver our care are the staff, and if we don't get their training and development right, they're not going to be able to deliver great care. We have some brilliant staff in social care, and the work of the Vanguards is looking at how we can make them even better and deliver high quality care to the residents.
East and North Hertfordshire are upskilling residential care practitioners so that they can better care for residents with complex needs and prevent them from being admitted to hospital or using urgent care services and keeping them in their homes. If we can make the staff that are currently in the homes feel more appreciated and feel more empowered, they want to stay in those jobs. On the ground, we do a lot of training around particular subject areas because we feel that you should have a go-to person in your home. For example, dementia, you have your dementia champion in your home. That person can mentor you, that person can coach you if you have something you want to talk through, or they can train.
High quality dementia care really matters in care homes. Nearly 80% of all residents will have a dementia diagnosis, and we know that you can make really big improvements to people's care by being able to deliver high quality dementia specific care to them. The care homes work has really started to look at how do we do that systematically across health and social care.
It's nice to give us more knowledge so we've got more power and then we can spread that out to the care team. In place how you wanted it by, yes.
The benefits that we really see already is how confident the staff feel. You give them that extra competence and all of a sudden they feel like they can talk to GPs about their residents and the GP believes that they understand what they're talking about. It's their competence and confidence levels have skyrocketed and it's really benefiting the residents.
So you can do all sorts of things. You can improve care, you can get people to work together, you can bring organisations together. But if you don't get the people that have the money to come together and work together, it isn't going to last. And it's really important that we work with our providers and bring together the commissioners so that when we make decisions, those decisions will have the money in the right place to deliver the care that we need to the right people at the right time, at the right price.
Back in 2012, we had a care home closure that happened very suddenly, very quickly, with a significant number of residents have to be moved out of a home over a weekend. It was made even more complex by the fact that we had 2 separate contracts, 2 lots of quality monitoring information and data, and it was the main motivation for us to look at how we could do things differently moving forward.
The City Council was already doing its process to re-procure the services for care homes, and it was then a thought that actually if we're going to do this together, let's do it together as a joint contract.
Here in Nottingham, I think we were really fortunate because we've got a long history of partnership working, and because we had that really senior management commitment and support to make it happen, we were really keen, and I think we all had that can-do attitude right from the very beginning to make it work.
The benefits of undertaking this is we've got the one process, we've got one contract, have one specification that we can use. It really helps us to improve quality of care by working together. In the past we didn't have that. We were working in silos, we had our own performance management approaches, and we didn't see benefits across the whole city, and it really has changed.
It's brought care homes much more into the limelight than they were previously. They were probably seen as a bit of a Cinderella service, operating slightly to one side of the NHS. They're just as important as hospital beds. It's where all our most vulnerable residents are obviously going to spend potentially the rest of their lives, and we want to ensure that they're receiving good quality care whilst they're in those homes.
I think if we don't spread this and we don't get wider adoption, we miss a huge opportunity to really make a difference, to deliver better care for people in long-term care settings. To miss that opportunity would be a real shame.